Hey everyone, welcome back to the channel. Today we are going to talk about one of the deadliest events in human history, the 1918 Spanish flu pandemic. This virus changed the world and left a mark that people still remember today. The year was 1918. The First World War was ending, and the world was full of uncertainty and suffering. Soldiers were returning home from battlefields, cities were crowded, and hospitals were overwhelmed. In the middle of this chaos, a deadly enemy appeared, one that could not be fought with guns or bombs. It was a virus that spread across the world, killing millions of people. This pandemic is known as the Spanish flu. Even though it is called the Spanish flu, it did not start in Spain. The virus got its name because Spain, being neutral during the war, openly reported cases of the flu, while other countries tried to hide the truth to keep up morale. Origins of the Spanish flu. Scientists are still not sure exactly where the Spanish flu started. Some say it began in the United States in Kansas, while others suggest it may have started in Europe or Asia. What is clear is that the virus spread very quickly. It reached every corner of the world in less than a year. The Spanish flu was caused by the H1N1 influenza virus. This virus was different from regular flu viruses. It was extremely aggressive and could kill young, healthy adults, which is unusual for flu viruses. Most flu viruses are more dangerous for the very young, the elderly, or people with weak immune systems. How the virus spread. The Spanish flu spread in 3 waves. The first wave began in the spring of 1918. At first, it seemed mild. People caught the flu, but most survived. However, by the summer, the virus returned in a second, much deadlier wave. This wave caused the highest number of deaths. It spread rapidly because of the war. Soldiers moving across countries carried the virus to new places, and crowded cities helped it spread even faster. People did not know much about viruses at that time. They tried to protect themselves by wearing masks and avoiding crowds. Some cities closed schools, theaters, and public events. But these measures were not enough. Millions of people became sick, and hospitals could not handle the number of patients. Symptoms and deaths. The symptoms of the Spanish flu were severe. People felt extreme fatigue, high fever, and body aches. Many developed pneumonia, which made it hard to breathe. Some patients died within a few days after getting sick. The virus was especially deadly for people aged 20 to 40, which was very unusual. It is estimated that the Spanish flu infected 1/3 of the world's population. Between 50 and 100 million people died. To put this into perspective, the First World War, which was one of the deadliest wars in history, killed about 17 million people. The Spanish flu was far worse. Life during the pandemic. Life during the pandemic was difficult and frightening. Families lost loved ones quickly, and many households were left with no one to care for children. Hospitals were full, and doctors and nurses were overwhelmed. In some places, there were not enough coffins, and mass graves were dug to bury the dead. Governments and health organizations tried to stop the spread. Public health campaigns were created to teach people about hygiene, such as washing hands and covering the mouth when coughing. Newspapers published advice and warnings. Still, people had little protection against a virus they did not fully understand. Impact on society. The Spanish flu had a huge impact on society. It changed the way people thought about public health and medicine. Governments realized the importance of having better healthcare systems and more research into diseases. Many countries created organizations to monitor and control infectious diseases. The pandemic also affected the economy. Factories closed because workers were sick, trade slowed down, and many businesses went bankrupt. Schools and universities closed, and public gatherings were limited. The world was still recovering from the war, and the flu made the recovery even harder. Science and research. After the pandemic, Scientists studied the virus to understand it better. It took decades to learn more about the H1N1 virus. Today, we know that influenza viruses change over time. This is why flu vaccines are updated every year. The lessons learned from the Spanish flu helped prepare the world for future pandemics, such as the H2N2 flu in 1957, the H3N2 flu in 1968, and even the swine flu in 2009. Stories from survivors? Survivors of the Spanish flu shared stories of loss and suffering. Some described entire families dying within days. Others spoke about hospitals that could not keep up with the number of patients. These personal stories help us understand the human cost of the pandemic. Even today, these stories remind us how dangerous a pandemic can be if not properly controlled. Global spread. The Spanish flu spread across continents in months. Ships, trains, and soldiers helped the virus travel quickly. Every country, rich or poor, was affected. In Asia, Europe, Africa, and the Americas, millions became sick. Cities that were crowded and poorly ventilated suffered the most. Even remote areas were not safe. Some indigenous communities were nearly wiped out because they had no immunity to the virus. Comparison to modern pandemics? The Spanish flu is often compared to modern pandemics, including COVID-19. Both viruses spread quickly, cause severe illness, and force governments to take action. However, there are differences. In 1918, there were no antiviral drugs or vaccines. Today, scientists can develop vaccines faster and medical care is more advanced. Despite this, the lessons of the Spanish flu are still very important. Social distancing, wearing masks, and hygiene remain key ways to control the spread of a virus. Lessons learned. The 1918 Spanish flu taught the world many lessons. Viruses can spread globally very quickly. Public health measures, like quarantine and hygiene, are essential. Hospitals and medical systems need to be prepared for pandemics. Accurate and timely information saves lives. Research and science are critical to understanding and controlling diseases. Even though more than a century has passed, these lessons remain relevant today. Every pandemic reminds us that the health of one person can affect the health of everyone. Legacy: the Spanish flu left a permanent mark on history. It changed medicine, public health, and how societies respond to disease. It showed the importance of international cooperation, science, and preparedness. Today, researchers continue to study the virus to understand why it was so deadly and how we can prevent future pandemics. The pandemic also influenced art, literature, and culture. Writers, poets, and artists reflected the sorrow and fear of the time. Families who survived the flu carried memories that were passed down through generations. Conclusion. In conclusion, the 1918 Spanish flu was the deadliest pandemic in human history. It killed millions of people and changed the world in many ways. Understanding this pandemic helps us appreciate the importance of public health, medicine, and global cooperation. It reminds us that even in modern times, we must be vigilant and prepared for future health crises. The story of the Spanish flu is not just about death and loss. It is also about human resilience, science, and learning from history. By studying the past, we can protect our future. Thank you for watching. If you found this video interesting, don't forget to like, share, and subscribe. Stay safe, and remember, history can teach us a lot about the world today.